as weird as it might seem, or it may seem uncomfortable to you, it's actually not a problem for the baby. It doesn't cause them any harm. It's just more of a sound that they make, similar to what we mentioned earlier, but it's not anything that's going to cause them any sort of difficulty or a sign of anything bad.
You're listening to the Mommy Labor Nurse podcast, where you'll gain the tools, knowledge, and confidence you need to erase the unknowns, feel in control, and have an even better birth, no matter how you deliver. My name is Liesl Teen, mom of two, practicing labor and delivery nurse, and your host. From over 8 years and counting of working at the bedside, I know that knowledge is the key to an even better birth. So tune in each week to learn about all things pregnancy, birth, and postpartum from me, a labor and delivery nurse that's seen it all. And now let's get into this week's episode. This week on the Mommy Labor Nurse podcast, I am joined by my friend and fellow podcaster, Dr. Mona from PedsDocTalk. Dr. Mona Amin is a pediatrician and parenting expert who equips parents with the tools they need to thrive and feel confident in parenthood. In today's episode, Dr. Mona is going to go through 10 newborn realities with us that are actually very, very normal. Things like hiccups, day and night reversal, and feeding volumes. She put together the things that parents of newborns are often really worried about, but are actually considered par for the course. So get ready to get some newborn education on and feel a little more like a pro in those early days and weeks, because sometimes it's hard to feel like you know what you're doing because you feel like you don't know what you're doing. And after you're done with this episode, you can keep learning about the newborn days with Mona. She was on my podcast before, way back in episode 9 when she came on the show to answer your most common newborn questions. But for now, let's get into our list of 10 common newborn behaviors with the wonderful Dr. Mona. Hi, Mona. Welcome to the Mommy Labor Nurse podcast. Thank you so much for being here today.
Oh, it's so nice to be back. And I love connecting with you and can't wait to chat with you today.
We're podcast buddies. You have your own podcast and it's huge. And how long have I known you? Like 3-4 years, something like that?
Yes. I mean, I joined social media in 2019 and you were one of the first people that I followed, because I think I had mentioned this on the other episode too. If people haven't listened to that one episode we've done already on your show, you were one of the first people I followed because everyone was saying, oh, people don't do education on social media. It's not a reality. And then one of my friends was following you because she had a newborn and she could utilize your resources for obviously postpartum and preparing for delivery. And she was like, you have to follow this account. And I'm like, wow. When I joined, I was like, wow, this is incredible. Look at what she's doing. She's educating and it works. And so you were my inspiration, telling me before it got really popular to educate on social media that this is doable. Now it's like I can't get away from education. It's like everyone's trying to tell me something, right? On social media.
I know.
Yeah.
It's
so you're one of the pioneers for education. So I love it.
I was.
Yes, I really appreciate that. So that's how I obviously reached out to you. I've told you this before, but you helped me in terms of helping me grow my platform, in terms of like sharing my account, connecting. We talked a lot about the whole world of social media. And, you know, at that point, you didn't have your podcast. I think at that point, it was your Instagram, your courses. I was just blown away. And again, I'm just so amazed and awesome to watch what you're going through. And it's just so nice to connect. And like I said, I feel like I know you in real life, even though I haven't met you yet. But one day it'll happen. It's
crazy. One day. Yes. I met Mama Dr. Jones in real life last year, and that was surreal. And I met a few other people on social media. And it's just weird because, you feel like you just already know them. What I thought was so interesting was seeing somebody 2D on Zoom is like so much different than seeing them in real life, because you're like, oh, you have this freckle here that I never noticed. And like something about your features or your mannerisms. You know, I'm only seeing you from like, waist up all the time, or in videos or something you're walking, but it's like so different to see somebody in 3D. So
I know. I only met one person that I've met on social media, and that was Dr. Marta Perez. She's an OB also.
Yeah.
Love her. In Florida. But like, there's so many people. And like you said, you almost feel like you do kind of know their mannerisms. And then when you meet them in person, you're like, are you the same vibe or are you different? Like, yes, I love it. So one day it's going to happen.
It will.
Next year, we're going to do this.
We will. All right. Well, you kind of already told our listeners a little bit about yourself, but can you just give us the breakdown where you're at on the internet and your podcast and tell us about what we're going to be talking about today.
Yeah. So I have a platform called PedsDocTalk. So PedsDocTalk, PedsDocTalk, one word. And I started as an Instagram account to share health, development, and parenting information. And it's kind of blossomed into a podcast, a YouTube channel, e-courses. I'm launching some toddler courses this coming spring in May of 2023. And so it's been a really great platform just to kind of share the ups and downs of parenthood, but also just educating families with all the stuff that I know from child development, parenting, and health without shame, without judgment, and really just laying out all the facts like, hey, this is something you can try. This is not harmful. Remembering that there is so much nuance in health, parenting, and development. So it's been so much fun. So doing what you do. And one of the things that I started doing was creating a course for new moms, especially to navigate them through that first year. So talking about feeding, so breast, formula, baby-led weaning, purees, sleep, if they want to sleep train, and then also talking about development. And then one of the biggest things I talk about, and I have a handout in my course, is weird things that newborns do, because I have so many times that parents come in, especially those new parents that are like, look, my kid is doing this thing and I don't know if it's normal, but is it normal? So that's what we're going to chat about today. 10 things that newborns do that are actually really normal. And I don't want to scare parents because I feel like this is so many times that they come in and they're like worried, and I'm going to really normalize, probably talk to you also about when to be concerned about these things. But I want to really kind of squash any concerns parents may have when they hear all these things that we'll go over.
Yeah, there's a lot too. I remember when I was in the hospital with my first one, right, fresh postpartum, and the nurse said, yeah, babies are very loud. Like, you'll notice that they grunt sometimes and they just make noises next to you. And she's like, it's normal, but you think that babies are only loud when they're crying, but they can be loud at rest. Like, they just make baby noises, and that's totally okay.
Yes, that would be my 11th one. That is so common, but yes, you're right. They're making like these, they sound just like old men, like clearing their throat, and they'll be fast asleep, and parents will just be staring at them like, well, what is going on, baby? Like a freight train coming through, you know?
I know. Crazy. Well, let's talk about this first one. This first one is peeling skin. What is up with that, Mona?
Yes. So every parent will come in and say, look, the skin is peeling. What's going on? And can I do anything about it? So this is really common. And in some babies, it's going to look even more prominent. Like, you're going to have a baby that feels like, oh my gosh, like their skin is just peeling all over. A lot of it has to do with baby being in a water environment for 9 months. Obviously, some babies may be a little earlier than that, especially if we have those post-dates babies, like the babies after 39 weeks, they had that extra 1 to 2 weeks in that watery environment. They come out and their body isn't used to not having any moisture, right? Like, they're in now going from a water environment to having just the elements of nature on the outside. So they get very dry, and that newborn skin peels. And I describe it like peeling like a snake, like, you know, snake skin peels off. It's going to peel. It's going to look really dry and rough. And then once that peels, you're going to see that baby's usual typical skin complexion, skin texture is going to be much different. So with this, it is totally fine to just leave it. It's not harmful to the baby. It's not going to hurt them. If it's really bothering you, because I can tell you it's not going to bother the baby, they're too young to understand. You can use any like non-fragrance lotion, or anything that's not fragranced or super harsh. Any baby lotion that's non-fragranced is perfectly reasonable to use. It can really help them.
Are you in search of the perfect pump for your breastfeeding days? Proven to provide more milk in less time, the Motif Luna is a powerful breast pump that's built for modern motherhood and covered by insurance. With a battery-powered or non-battery version, the Luna is perfect for today's busy mom. The Motif Luna breast pump is lightweight and sleek, quiet and customizable, so you can quickly find what works best for you and your baby. The Luna also features a backlit LCD screen, built-in nightlight, closed system, quiet motor, and auto shutoff. And the battery-powered model gives you even more freedom and flexibility with a rechargeable battery that lasts over 2 hours. But beyond the features and ease of use, the Luna works. In a third-party study, 5 out of 6 moms reported more milk in less time than the leading pump brands. As a pumping mama, I personally used and loved my Luna pump. The expression mode works to express milk as efficiently as possible, while the massage mode would stimulate my letdown by mimicking my baby's natural nursing pattern. Sophisticated, strong, and soothing, covered by insurance, get ready to make your pumping days easier with the Motif Luna. To learn more about the Luna and order one for your breastfeeding and pumping journey, head on over to motifmedical.com. And as a special offer for all MLN podcast listeners, you can get 15% off site-wide, including the Luna plus all supplies and accessories with the code MLN23. Some exclusions may apply. That's code MLN23 for 15% off site-wide at motifmedical.com. And that's to say too, can you talk about the vernix and how that kind of plays into it? Because I know that you talked about post-dates. When babies are post-dates, they have a lot less vernix on them. And that kind of goes hand in hand with that, the peeling and the moisturizing of the skin.
Yeah, so that vernix is that kind of coating of that skin that parents will see. It's usually creamy. It's usually like, again, in that first time after delivery. And sometimes, obviously, when they get the bath, it's going to get washed off. But really, we recommend leaving it on the skin. And I know you know that. Delaying the bath if we can, just because it does provide some protection of the newborn skin, also some immune properties there. So we do like it as a coating of the skin. But yes, it's very common, whether the vernix was wiped away early or not, it is very common to see that dryness.
The peeling.
That peeling, yes. And it's something that will get better. I think parents, when they see their newborn baby, I think a lot of times we expect the baby to look pristine when they come out, like no blemishes, no acne, we can talk about that. And then all of a sudden we see like this sort of peeling. And so parents like, oh, well, what about my baby photo? I want the cute photo. I'm like, look, it's going to get better. Usually I see it improve 2-3 weeks of age, that you're not seeing that sort of peely skin. And I've seen it pretty significant to the point where parents are like, this has to be some sort of infection or rash. And I'm like, nope, it's just skin peeling. Of course, if a parent sees like redness or maybe seems very uncomfortable, but I've been practicing for 7 years. I've never seen peeling skin be at that age, a concern. So something just to monitor as long as the baby's overall well.
Right. And scratching too. They come out sometimes that they've just got scratches and then they scratch themselves again. And that is not so good for the photo hops either.
I know. I get it. I understand why parents care about that. Nothing bad about that. I get it. But yes, all of this is totally normal. And the scratching and the guilt from scratching. They're like, oh my gosh, I need to put my, mittens on. I'm like, it's totally normal. They're never going to scratch themselves to permanent harm or injury or damage. Just keep the nails either filed short, cut short, but they need to kind of get used to their hands and stuff. So no need to, bundle them all up in mittens and all that. It's something that they will learn that I probably shouldn't scratch my face over and over. It's not something I should do. So totally normal as well.
Yeah. Well, let's go into this second one. This one is cluster feeding. Talk to us about that.
And you probably experienced this as well.
Oh my gosh,
and it's common, people feel like it's only breastfed babies, but it does happen in formula-fed babies. I will say though, I'm also an IBCLC lactation consultant. I will say that it's more common in breastfed babies. So this cluster feeding, I'm sure people who have already been through this phase know what it is, but if you have not, cluster feeding is when your baby is kind of doing your normal feedings. Maybe it's like 20, 25 minutes on both breasts or one breast. And then all of a sudden, they're doing rapid feedings in succession. Like they're just doing like every 10, every 15, or just feel like they're constantly on the breast. Now, cluster feeding is actually really normal because in a physiological way, clustering allows you to produce more milk. We know that.
Right. Yeah.
Yeah. In order to produce breast milk, we have to eliminate it, right? So if your baby is clustering, that means that they're eliminating milk from your breast, and then the milk will be able to fill back into the breast, making you produce more and more. So clustering is actually really common in that first 6 weeks. And it's going to feel very stressful sometimes because it can go from your baby being on some sort of quote unquote rhythm. And then all of a sudden it's like, what is going on? Like all of a sudden my baby wants to feed all the time. It's very, very common. Now, if you're concerned that they're clustering, I'm putting that in air quotes, and they're not gaining weight, they're seeming very hungry after, like their body's not relaxed after, their fists are tight. They just seem like they're searching for food. I like to differentiate that clustering is a true sort of, they're hungry, they want it, they're feeding, they're relaxed after, but they want it again. If a baby is feeding and you call it clustering, but they're not satisfied, then I'm concerned that are we getting enough, right? So there is a nuance there that we don't want to say that every time a baby goes to the breast, that means that they're, clustering and that's okay. But if you're finding that your baby seems to want to feed all the time and is just not seeming at all relaxed after, satisfied at all. And more importantly, you're just feeling like, oh, they're not gaining weight. They're not making wet diapers. Then we're dealing with, let's make sure production is not an issue. Let's make sure that weight is not an issue. And then we'd like to see that baby in the office. But if your baby's happy, relaxed, making pee, comfortable in between, that is very common. And we wait it out in terms of just offering it, making sure that you're protecting your mental health if it's getting draining, having help if you can, just because I understand that it can feel draining, especially in the middle of the night when your baby wants to feed every 2 hours to help increase your supply. Did you go through that? Because you breastfed, right? Yeah.
Oh, yeah, for sure. With both of mine too. And I was going to say it was a mindset shift for me with my second one, because I looked at cluster feeding way more in a positive light than I did with my first one, because I basically was like, well, the more times that he goes to the breast, the better that my milk supply is going to be. So, hey, like, let's just keep feeding, because I had a lot of issues with my milk supply the first time. So it was tough, right? I mean, it wasn't like, yay, I get to breastfeed 15 times today.
Yes.
But it was that mindset shift that really helped me. Like, okay, well, this does mean he's trying to up my milk supply. He wasn't losing weight or he was making wet diapers. I knew it wasn't that issue. It's just he was cluster feeding and he was trying to tell my body like, hey, make more milk. And so I just looked at it like, okay, let's make more milk.
I love it. I love it because that actually helps the stress of breastfeeding. And we know that the stress is not a great place for anyone, but for breastfeeding, especially the obsession, the worry, all of that can really help tank our supply. And we don't want that. So really just saying, I got this, we're going to figure it out. I love it. It's such a good mindset. It helps so much in all aspects of that postpartum experience. Oof. Yeah. Yes. I know it's hard though sometimes to find that, but it is important.
Oh yeah, for sure. Yeah. Well, this next one kind of goes in with cluster feeding because I feel like they do this when they're a little bit mixed up. This next one is mixing up their days and nights. How do they know when it is 8 o'clock in the morning versus 8 o'clock at night? And sometimes they're up and,
This is one of those things that I knew before becoming a parent myself. But of course, you experience it and you're like, oh, well, here we go. But I remember I had a lot of friends who were like, they'd have their baby. And that first 2 weeks, they were like, oh my gosh, my baby's sleeping amazing. Like, this is so great. And then all of a sudden, they don't remember, okay, what's day, what's night. They're up during the night, sleeping during the day. And the parents get really nervous because they're like, well, this wasn't the case. Like, why are their nights and days mixed up? I want them to sleep through the night. And we have to really normalize newborn sleep here. So to answer your question, around 1 month to 6 weeks is when we can see more of a circadian rhythm. And that circadian rhythm is, you're awake during the day, you get sleepy towards the end of the day, you fall asleep at night, and then you wake up early in the morning. When I say some sort of circadian rhythm, obviously a 6-week-old is not going to be fully sleeping through the night. I know some babies who have, and that's awesome. And a rarity, but that's great. But it's not unusual before that 6-week mark for a baby to be up at night, sleeping during the day. And that can really stress parents out. And kind of what you said about that mindset shift on cluster feeding, really saying to yourself, this is a normal phase. Obviously there are things that we can do, which is when it is bedtime, which is nighttime, like sleeping overnight, making it dark, making it cool. But even that in the daytime, if your baby is not getting like full darkness for naps in the daytime under the age of 6 weeks, it's okay. They can still sleep if they want. You don't have to have it pitch black during the day, but at night, you're going to have that dark space. When you are awake with the baby, you're going to take them out. But as you and I both know, in that newborn period, in that first 6 weeks, they're sleeping and feeding a lot. So you're not going to time them to like, okay, now I'm going to go outside and get sunlight. And now I'm going to do this. You're kind of letting them lead the cues. And then just by nature, that rhythm is going to come. And that has a lot to do with melatonin production and things like that. That's going to help them understand that, oh, nights are for sleep and days are for being awake. And they were in a dark environment for 9 months, like I said, with the peeling skin too. Like they don't understand day and night cycles. And that's how a lot of our circadian rhythm is created, with not only just natural melatonin, but our natural cycle of seeing daylight in the morning, getting dark at night. And they don't have that yet, but they will. So really be patient that first 6 weeks, change your mindset and understand that, hey, this is normal. I'm not going to put my newborn baby on these expectations that they have to sleep through the night at this age, or they must be doing this, because it's very natural for them to have that abnormal sleep cycles, but also just those days and nights mixed up for sure.
For sure. It's rough. Yeah. Very normal.
Yes.
All right, the sound of that heartbeat means it's time for this week's segment of Birth It Up Babies. This one says, I can't say thank you enough for your awesome course. Oh, I'm 2 weeks postpartum and I am still so proud of myself for making it through labor naturally. I could never have done it without y'all, all of your tips and tricks. Oh, I love that. I'm not even trying to say like my course is the best course in the whatever. I just love that I hear this so often that people say, I am so proud of myself. Regardless of if you went natural, you got an epidural, but I hear that so much in messages that I get from you guys who have taken my courses, that they have this feeling, just kind of this proud feeling, just kind of last through postpartum. And it just warms my heart. She says, you do such a great job of giving actual tools that can help. This was my second baby, and I went in so much more confident and informed than with my first. My husband was also so much more prepared to be a bigger help to me. Thank you. Oh, so sweet. If you want to have an even better birth, just like this mama, head on over to mommylabornurse.com/courses to learn more about our 3 online on-demand birth classes. So this next one definitely takes girl moms by surprise. Let's talk about this. Breast buds and vaginal discharge for the baby, not for you.
Yes, I know, right? Everyone's like, well, duh, like this is going to happen for me.
Yeah.
This is actually a really cool one to talk about because, like I said, it's one of those shock things that parents come in for. And breast buds can be in both babies that are boy or babies that are girls. It has a lot to do with hormones from the mom, right? Hormones from being in utero. They come out and it's almost like a baby period, baby puberty is what I describe it. And they develop these breast buds, and these breast buds are going to sometimes feel like little marbles underneath the nipples. We do not want you to touch them, play with them too much because that can aggravate them. Just let them be. And then also because of hormones from the pregnancy being in utero, little girls can develop vaginal discharge, which looks like a little period. So when you wipe them, you can see vaginal discharge, you know, that yellowish, whitish discharge that we as women get as well. But also blood. And it shouldn't be copious. Like I'm not talking like it's going to be like how we get. It's going to be just like smears of it. And you're going to be like, what is this? And it should go away by 2 to 3 weeks as they kind of adjust to being out of utero. But it has a lot to do with those maternal hormones. Very, very common. And it's all benign, very common and nothing to worry about. And you just kind of wipe front to back if you see it. No scrubbing and rubbing for any of that discharge. No need to clean like you don't need to go wild with any sort of fancy cleaning. And then with the breast buds, like I mentioned, trying not to fixate too much because yes, by just over touching and over looking at it, then we can kind of get a little more irritated in that area. So just kind of letting it be.
Yeah. Makes sense. It definitely takes you by surprise when you first see it, I'm sure.
I see this all the time and I'm pregnant with number 2. I'm sure I'm going to deal with this and it's a girl. So it's very exciting. Yeah. So I'm sure I'm going to have the same, probably the vaginal discharge experience that we probably had. But yes, it's very common to hear it. And I still hear it all the time, which is why I wanted to talk about this on the episode, because I'm like, this is definitely something that needs to be out there in the world, that these are all very normal things.
I know. Yeah. I feel like when you read the articles, this one definitely isn't in there as much. You know, they talk about, okay, cluster feeding is normal, but they don't talk about that a baby girl might have a little period. I swear. I don't see that very often on the internet. So I'm glad that we're talking about it today.
Yeah.
Well, this next one is blue hands and feet. What is that about?
Yeah, so this is also something that can be super scary. And I'll clarify when we would be concerned about this, but their hands and feet will come out looking more purple or blue than the rest of their body. And I think you've talked a lot about APGAR scores. This is why no baby really gets a perfect APGAR, like a 10 out of 10. Like they're going to have a 9 because they get blueness on the feet and hands, which is completely normal. And this is actually the medical name, if people like to be nerdy about it, is called acrocyanosis. Yeah. And it's common due to normal limited blood flow to the area. So their blood flow system is obviously developing. They don't have as much blood flow to the hands and feet, and it self-resolves. And, parents will say that their hands are so cold or their feet are cold. Absolutely. But again, I like footy pajamas or little socks when they sleep, but having their hands open and not putting mittens on them is actually not a bad thing. You don't have to keep their hands covered. It's not like you doing that is going to make this acrocyanosis worse. It's something that will just get better on its own. So don't feel like if you see the blue, that means that you have to put mittens on. It's just a very natural process that will resolve. Now, blueness on the hands and feet, I have no problem with. But of course, like blueness in the middle section of the body, so around the lips, the nose, the midsection, like the stomach, belly, of course, we'd want to know that. But hands and feet, not concerned. Everywhere else, like if it's in the middle of the body or around the lips, please let us know. Or obviously, if you're in the hospital, your staff should probably see that as well.
Yeah, for sure. Well, this next one happens definitely from birth, because this is something that the reflexes that they check right after birth. But let's talk about that startle reflex and just tremors in general.
Yeah. So babies have a very prominent Moro, M-O-R-O reflex. And this is actually one of the very common reflexes we want to see in newborns, which is, like you said, the startle reflex. So the exam would be like they're laying on their back and the doctor may lift up their body just ever so slightly off the table and then let them go. Obviously no injury there, but very slightly you'll see, and their hands will just kind of jerk, like they'll just kind of go, whoa, and their hands will jerk back and forth. Very common to have that normal Moro reflex until about 3-4 months, it goes away. Now, also because of their very immature nervous system, they are just very jerky and they'll move their body a lot when startled. So if a door slams, if a dog barks, like very small things will jerk them. It doesn't mean that it's going to impact them in any way. Like people use sound machines, but if you don't use a sound machine, you're not it's not a harmful thing. It's literally very common for them to have this. And also when they're sleeping, they're going to jerk a lot. So if you were to just stare at your baby, you're going to notice a few things, the noises that we mentioned earlier before we started, right? And then you also may notice little twitches. Like if you were to just stare at their leg, you'll notice little boop, boop, right? But the difference with this is that this is very normal to see shaking, tremor. Sometimes their leg will just start to all of a sudden just start to shake in a very, very small way. Now, the difference between this and something concerning, and I like to explain this like it's rare, but like a seizure, right? Seizures are very different, but I like to talk about this because many parents are worried because they're like, is this neurologically normal? A seizure in a newborn or any child, if you were to like place your hand over the leg, like just say the leg is moving, okay? And you were to hold that leg with not obviously good pressure, like you're holding it down. And if it still is jerking through your hand, like you're still feeling the rhythmic jerk of it, that's more concerning to us. But a normal tremor, shake, if you were to just hold it gently with your hand, like hold the leg down, you would feel it start to suppress. You would feel it start to go away, and it would just be something that kind of goes, and then it may come back. But that's kind of the difference. But it is very common. Parents will be like, wow, they're just so sensitive. There obviously are rare cases. I don't think anyone listening hopefully won't find themselves here. But if a parent has been taking any sort of drugs during pregnancy, there are some situations where babies do have excessive tremors. But as long as you are not taking any street recreational drugs during your pregnancy, which I hope you're not, I'm not worried about that. But that is something that we also see. But in the more, by and large, these tremors and shakes are extremely common, and they can be kind of like, what is going on, baby? Similar to the sounds that they make that you mentioned earlier.
Yeah. Another time we see it sometimes is right after birth. If mom has really severe gestational diabetes and baby's like the blood sugar is really, really low, they have that low blood sugar shake sometimes. Yes. And that's not normal. But, we want their blood sugar to get up. Like you said, they are loud and they just move a lot. Yes. That's just how they are.
Yes. Yeah.
Yeah. So you mentioned about the dog barking or a door slamming, and I wanted to just make a note. They have that Moro reflex when that happens, but that doesn't necessarily always wake them up.
Correct. Yeah. It is a reflexive thing. all of this is completely, like I said, they're doing it within their sleep, similar to the noises that they make. So it's not like it's going to startle them awake. They could be fast asleep and they just go, boop, their body just shakes like that and they settle back down. Completely normal.
Right.
Yeah.
Well, this next one is hiccups. Talk to us about that. Because sometimes you
hiccups.
can feel it. You can still feel, you can feel them while you're still pregnant.
Yeah, so this is actually really an interesting one because I do believe there's a correlation, and I don't have a study to back this up, but if a pregnant person was feeling that baby hiccup in utero, then they're more likely to have it when they get out of the womb. Like my son never hiccuped. Like I never felt him, and he never had hiccups as a newborn. Like I never felt him hiccup at all. Like when he was a baby, never. And I'm not sure what's going to happen with this baby when I'm pregnant right now. But hiccups are very, very common. And like I said, especially if you felt them in utero, and they also have to do with the immaturity or irritation of the nerve that goes down to the diaphragm. And a lot of it just has to do with them getting older. So irritation, meaning you don't have to do anything. But yes, if they're drinking something like breast milk or formula, when they drink, the liquid could hit the nerves going down to the diaphragm or the proximity of it and cause that sort of spasm that goes up, that hiccup sound that you hear. But there's nothing that I need you to do. Like you don't need to startle your baby, make them drink water. Like, when adults have hiccups, they really do go away on its own. And hiccups are one of those things that a lot of grandparents in my office will come in and say, oh yeah, I'm going to give them some tea that they can drink for it. And I'm like, it's actually not necessary to do any of that. As weird as it might seem, or it may seem uncomfortable to you, it's actually not a problem for the baby. It doesn't cause them any harm. It's just more of a sound that they make, similar to what we mentioned earlier, but it's not anything that's going to cause them any sort of difficulty or a sign of anything bad.
Got it. And I wanted to just touch on quickly, because I'm about to do a post on this soon, is utero hiccups. There is some talk that people think that for some reason it's harmful if you feel hiccups in the womb, that it's like harmful or it means something. I don't know.
Interesting.
Yeah. Have you not heard of that?
No.
Oh, yeah. If you Google baby hiccups in the womb, there is definitely myths out there that people think the blood flows off. It's something with utero compression, I think, or I'm sorry, umbilical cord compression. But I just wanted to touch on that like, hey, if for some reason someone told you that if you feel hiccups, there's something wrong with baby, that's not true. Hiccups are totally normal in utero.
Yeah. And I know you also talk a lot about like fetal movements and stuff like that, but it all goes in the same. Like, of course, if there's concern of there not being like fetal movement and things like that. But yeah, correct. Hiccups are actually really common in utero. And also after they come out, it's a big picture thing, I imagine. Like, it's not anything like, oh, hiccups alone. It's okay. Hiccups. Do you feel movement in general?
Right.
Are you going for your monitoring? But yes, I agree. Isolated, I'm not concerned.
For sure.
Yeah.
Are you a third trimester mama that's wondering what you should actually be doing to get prepared for birth and baby? What if I told you I have a free third trimester prep pack to take the guesswork away? It's true. Inside of this jam-packed set of printable PDFs, you'll get instant access to our super popular hospital bag checklist, birth plan templates created by my team of L&D nurses, a third trimester to-do list with over 20 different things on it, my exclusive list of postpartum essentials, and more. It's an instant free pregnancy planner to get and keep you on track in your third trimester. To grab the third trimester prep pack for free, simply head over to mommylabornurse.com/third trimester. That's mommylabornurse.com/THIRD trimester for your free third trimester prep pack. Well, this next one is periodic breathing. What's that about?
I wish I had a video to show this, but periodic breathing is also kind of in line with all those weird things that babies do, especially with noises. But periodic breathing is when a baby breathes very fast. And I'm going to kind of do this, but they go, If you were to look at your baby, you're going to see their chest and it's going to go rapid. Like they're going to breathe very fast. And then it's going to slow, and then breathe very fast, and it's going to slow. And so this is actually really common. It's a very, very appropriate breathing pattern for a newborn, postpartum, up until about 2 months of age. We're going to see this sort of periodic breathing where they breathe fast and slow it down. Now, the difference here, when, obviously I would love parents to know when is difficulty breathing a reality, is when it's just constantly fast, for example, color change. And even if there's not color change, you're just seeing those ribs retract quickly in and out, and there's no reprieve, right? It's just literally fast, 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 fast. That is different, but it is not unusual. And I know a lot of parents listening are probably just staring at their baby, looking at their peeling skin, looking at the noises, looking at the twitches that they do, the hiccups, and also this. It can happen while they're sleeping. It can happen while they're awake, but it's more concerning for parents when the baby's sleeping, right? Every parent worries about their sleeping baby. I think it's like a common thing. Like they want to stare at the baby. They just want to look at the baby. But as long as you're safe sleep, doing all the things you need to do, they're in the safest environment that they are. But the periodic breathing is that sort of fast, fast, fast. Slow it down. And it's a very common thing. And you don't have to wake them up. Please don't startle them awake. Let your sleeping baby sleep, and then they're going to be just fine. But it's a very common thing I wanted to make sure that parents know is very normal.
Yeah. Good. We got two more. This next one is baby's cross-eyed. It's kind of goofy to see.
I think it's so goofy and so cute.
I know.
Some babies come out of the womb looking like ready to go. Like their eyes are wide open. They're like, I'm ready to start life. And others, like I have to pry their eyes open to be able to examine their eyes at the newborn visit. Like they're just so drowsy the first 2 weeks. It's like such a difference. Yeah. But most babies, you're going to notice, especially like as they get into that 2 week, 1 month mark, that they appear cross-eyed. So just say they have a toy near them, they are not able to focus on things very close to them, right? Things are blurry to them. And also they're more likely to look at like black and white contrast images than actually make out faces and things like that. So in order to focus and the immaturity of their nervous system and their eyes, they're going to cross a lot. And it's going to feel like, wow, why are they always looking cross-eyed? And another thing is they may just appear cross-eyed, even though they're not, because they have a very flat nasal bridge. Like, as adults, we have a very prominent nasal bone, but with babies, it's cute, it's flat, their nose is small. But if you go to where the nose is, then go all the way top where the bridge is between the eyes, it's very flat. So because of that, it can look like they're cross-eyed. It's something we call pseudo strabismus, and it's actually a very common thing. Now, if a baby past 4 months is still seeming to be cross-eyed to a parent, or one eye is crossing more than the other, or fixed like that, or they're feeling like by 3 months, they're not able to like track an object. Like, like if you would have a rattle and move it across their visual field, if they're not tracking, then of course I'd want an evaluation for the eyes. But cross-eyed alone under the age of 4 months in a child who's developing well is a completely benign thing.
Yeah. It's just, like I said, goofy to see.
Yes, it's cute. I mean, I have some pictures of them, of my son, like, it is cute and goofy. And of course, if it's prolonged, then I understand that it's not cute anymore. We want to make sure that we evaluate the cuteness as well. But yes, completely one of those things I commonly see.
Yes. Well, this last one is the honeymoon period of sleep. That sounds so great, but what is it?
Yes. And I actually briefly mentioned this when I talked about mixing up days and nights. But another one of those things that I like to normalize, and that, again, just to reiterate, is that when you bring a baby home, and this is also very common, I'm drawing a blank on the second night syndrome. You know what I'm talking about? When the baby comes out and the first night the parents are like, this is great. And then the second night in the hospital, it's like, what the heck is happening? Right. There's a few normal things I see. One is that second night syndrome is very common, where the second night at the hospital or wherever you are is more of a kind of wild night. The second time that you can get a little wildness is when you go home from the hospital. Anytime I see families in my office, they got discharged day 2, day 4, whatever it is, they come to me and I'm chatting with them and I'm like, how are y'all doing? How are you doing at home? And they're like, we got discharged yesterday and last night was horrible. And I'm like, listen, I totally get it. You all are just adjusting to a new environment. The baby also is adjusting to this new environment from a new environment, like having to go from womb to hospital to home. Like everyone's adjusting. And again, this is one of those things that I like to just reframe mindset is some babies come out and the parents are like, wow, I don't know what anyone else is talking about. This baby thing is so easy. They eat, they sleep, they can sleep anywhere. They don't cry. And for the first 2 weeks, parents feel like they hit the jackpot, which I think is wonderful if you feel that way. But I always like when I'm in the office and they're telling me this, I always like to normalize and say, I think this is wonderful. I love that you're getting this experience. And I think parenthood is awesome, but I don't want you to be alarmed if things switch. Because what happens is then I get that phone call at 2-3 weeks. Doctor, something must be wrong. My child is feeding and gaining weight, but they're not sleeping and they're more fussy and crying. And it's very common for them to go through this honeymoon period for the first 2 weeks where they don't realize that they're now have to do work outside, right? That they have to feed, they have to poop laying down. They can't just poop in the amniotic fluid anymore. Like there's a lot of work that has to happen for that newborn. And they realize, oh, shoot, like I got to do this now outside of the womb. And it's an adjustment period, right? So this is very normal. Now, of course, if your baby is like fussy to the point where you feel like they have a fever, they're not feeding, then I'm concerned. But a lot of this is also getting into your rhythm of, okay, what are my go-to for soothing my child? Am I going to rock them? Am I going to walk around with them with a carrier? Am I going to, bounce on a bouncy ball with them? Because that honeymoon period, if you experience it, can really shock you because you're like, oh, there's something must be wrong because my amazing baby who slept and ate is no longer doing that. And it's not always the case, right? Very rarely is it something medical. Usually it's just nature. It's the fact that they realize, oh, wow, I have stimulation out here. There's a sibling running around. There's a dog. There's garbage trucks. Like it's just, and lights, like they just realize that they're a human now in a way. Yeah. And I find it also with my premature babies, like, parents coming in, maybe they were in the NICU for like a week or two, like a 35 weeker, and they're coming in like they're now 37 weeks if you adjust. And I'm like, they're like, yeah, they're just so sleepy all the time, but everything's going great. And then they sort of snaps, right? They all of a sudden click and it's like they're awake more and it's a good thing, right? They're out of the womb. Like they should understand, but I just understand also that it can shock a lot of parents. And I don't want you to be scared of that experience.
Yeah, for sure. I'm glad you mentioned the preterm thing too, because I was going to say that 37-week baby can be a very, very different experience than like a 41-week baby.
Yeah. And again, all this stuff is so important. The 10 things we talked about. And I have like so many more that I go over, but it's just so important because like I said, these things happen and I hear them so much as a pediatrician. And I'm sure even for you in the postpartum, labor delivery, you're also like dealing with a lot of that stuff like, hey, this is happening. Right. And it's just nice for parents to hear like, hey, this is when it's normal. This is something you're not alone with. I get that this is frustrating, all those feelings, because we know that postpartum experience can feel very isolating when it's you. And then also every parent wants the best interest for their newborn. And I get that feeling. I've been there. I know exactly how it is. And on the other side as well, coaching parents, walking them off a ledge to make sure they understand that, what, I get it. I understand that this is really unusual for you, but it's not something I don't see. And I want to really normalize these very common things that these little cute, adorable humans are doing.
I know. Well, that is a great way to end this episode.
Yes.
Can you remind our listeners where they can find you here on social media and the internet and on your podcast?
So your best bet is to go to PedsDocTalk, which again is PedsDocTalk on Instagram and also my website, PedsDocTalk.com. That's where you'll also be able to access the YouTube channel, my podcast as well, and any of the e-courses that I have. And yes, that's the website and my Instagram are my hub. And I just started venturing out into TikTok, uncharted territory at the time of this recording. But yes, I am pretty much on every major platform trying to spread to new parents all over, wherever they're at.
Love it. Love it, Mona. Thank you so much. It's always a pleasure. Thank you so much.
Yes. Can't wait to meet you in real life one day.
I know.
Yes. Have a great day.
You too. Oh, she is just the best. I just got off with her and I just love Mona, you guys. She is just a ball of energy and happiness. And you guys need to go follow her on Instagram and her YouTube channel and her podcast. Oh, just love, love, love her. Next week, we are going to be talking about induction, and specifically, I'm going to go through all of the different ways that you can be induced. It'll be a nice little in-depth induction episode. So if you have an induction on the horizon, or, maybe you were thinking you might be induced, definitely a really, really great episode to tune into. So I will see you guys next week. Already feeling a little more confident about pregnancy, birth, and newborn life? Don't forget to hit that subscribe button so you can continue to erase the unknowns and never miss an episode. And if you're looking for even more, Instagram is definitely where I hang out the most. Come join our community of more than 500,000 moms for birth education, tips, and solidarity. You can find me at mommy.labornurse. Check out today's show notes and a searchable library of every Mommy Labor Nurse podcast episode at mommylabornurse.com/podcast. And while you're there, be sure to head to the blog to learn about our online birth classes too. See you next week. And remember, you can have an even better birth no matter how you deliver.